In the name of God, thank you for joining us. My presentation is about the impact of digital health and medical technologies on healthcare. The main points are digital health, electronic health records, mobile health. I'm starting from digital health. What is the definition of digital health? Digital health is an umbrella term for a wide range of technology that can meet the healthcare challenges, and also it's the tools refer to the technology that deliver services to consumers and patients, and also can help them manage personal health, and also can improve wellness. The history of digital health. Digital health has evolved rapidly, and it was introduced in 2000 by Seth Frank. And FDA considered digital health as a broad scope that can include categories such as mobile health, health information technology, and wearable devices, telehealth, and telemedicine, and also personalized medicine, which is a hot topic today. The solution of digital health. Digital health solution can be grouped as follows based on potential risk to patients. For example, the first one is solution that can improve system efficiency but with no measurable patient outcome benefit. And the second one is mobile digital health, and that inform or deliver basic monitoring and also encourage behavior changes and longer, and also self-management. For example, patients can manage themselves to improve the quality of life. The third one is clinical decision support and prediction model that guide treatment, deliver active monitoring, and also calculate diagnosis. The benefits and the usage of digital health. Digital health can prevent diseases and promote and protect health and well-being, helping patient monitor and manage chronic conditions, improving quality of life, reducing the total cost. Another benefit and usage of digital health can include, for example, digital health can maintain good health for longer, and also we need fewer visits to the physician. And also digital health tool could help shorten the length of disease. The differences between digital health and also e-health. E-health is broadly defined by WHO as the use of information and communication technologies for health, but digital health is described more broadly as an umbrella term for areas including e-health, telehealth, and also mobile health. Some examples of digital health, for example, you can see mobile health, virtual reality, telemedicine, artificial intelligence, wearable devices, and also robotics. Digital technologies on healthcare. So you can see some of the areas where digital technology has made an enormous impact on healthcare that can include improved access to medical information and data, big data, improved line of communication, electronic health record, telemedicine, telehealth, online education, and also health apps. The first one is improved access to medical information and data. One of the biggest benefits of the digital revolution has been the ability to store and access data. So a healthcare professional can retrieve patient data from anywhere and anytime that they want, and also the internet has allowed healthcare professionals to share medical information with a specific standards or protocol rapidly with each other, and also resulting in more efficient patient care. The second one is big data. Another great benefit of digital technology that allows clinicians to gather big data in minimal time. So for those conducting epidemiological studies, research, or clinical trials, big data is very useful. And also it can allow for the instant collection of data from a much more diverse and larger population than ever before. Such data collection allows for meta-analysis and permits healthcare professionals to stay on top of cutting-edge techniques and trends, and also it allows clinicians to identify risk factors and recommend appropriate or preventive intervention steps more effectively. The third one is improve the lines of communication. And there was a time, not too long ago, for example, when healthcare workers use a beeper to communicate. But today, digital technology has made the communication between healthcare provider and patient easily, and the healthcare worker or healthcare provider can stay in touch through email, smartphone, text messaging, social media, etc. Technology has made all this much simpler, as you see, and much more cost effective. Also, a medical professional can make it their own webinar videos and use online platform and social media to communicate with other professionals. Teleconferencing has made it easy to communicate beyond geographical borders. The fourth one is EHR, or electronic health record. In the old days, a large paper files were moved from, for example, department to department, and it was paper-based. But now you can see every record, or for example, electronically gathered, analyzed, and we can use it in research. About the EHR, have made life easier for both healthcare provider and also patient, and can access to each EHRs has resulted in a centralized storage of all patient data and faster access for improved care and also better outcomes. EHR also enable faster, smoother, and easier medical billing. About electronic health records. Electronic health record is a secure integrated collection of a person's encounters with the healthcare system, and also provides comprehensive digital view of patient's health history. An electronic health record, for example, is an individual that confirms to nationally recognized interoperability standards such as HL7, and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organizations. The core functions of EHR. One of them is health information and data that can include medical and nursing diagnosis, medication lists, etc. Results management that can manage all types of results such as laboratory results electronically. Another one is order entry and support, for example, CPOE or computerized provider order entry can work for ordering medications. Another one is decision support that, for example, employs computerized clinical decision support capabilities such as reminder, alerts, and computer assisted diagnosing. Another functions of EHR are electronic communication and connectivity, for example, and that technologies can facilitate communications, and connectivity may include, for example, email, telemedicine, social media. And another one is patient support that can include everything from patient education material to home monitoring to telehealth. Administrative process that can facilitate process such as scheduling, insurance verification, decision support to identify eligible for clinical trials. Another one is reporting and population health management that can establish terminology and data formats for public and private sector reporting requirements. So now we can see the benefits of the EHR. Simultaneous access from multiple locations, legibility, variety of views and data, support and of structured data entry, decision support, support of data analysis, electronic data exchange and sharing, care support, multimedia patient report are the benefits of EHR. The differences between EHR and EMR. EHR contain information other than clinical information, but EMR or electronic medical record is used to indicate that it is the patient medical record at a particular facility. The fifth one of digital technology on healthcare is telemedicine or telehealth that you can see, for example, the telecommunication providing, for example, education can very useful by telehealth or telemonitoring, and also because of the rural area, video conferencing or accessing to the healthcare provider can be much more easier than when, for example, a patient want to come to the center, and also it's very cost effective. The sixth one is online education. So with the digital tool and digital technology, online education can provide, and nowadays you can see the COVID-19 situation and online education as well. And also you can access the education anywhere and anytime that you want. So it can reduce the cost and improve the accessibility of education. The seventh one is mobile health. The mobile health can, for example, patients with their mobile phone can monitor their health and disease and provide, for example, them medical information, allow them access to test results and promote them when, for example, they need it, for example, at the specific time for checking up. Also, mobile health enables a healthcare provider to quickly check and test the results, drug dosing recommendation, and other information they need urgently. About the mobile health and going into the detail of it, WHO has defined mobile health as a medical and public health practice supported by mobile devices such as mobile phone, patient monitoring devices, personal digital assistant, and also other wireless devices. WHO defines mHealth as a medical and public health practices supported by mobile devices, and they have a great potential to improve healthcare outcomes. It is broadly defined as the use of mobile phone or portable digital devices in healthcare, and also can be prescribed as an effective self-management tool for patients. Mobile health is enabling individuals to access healthcare services by removing geographical restrictions while increasing the coverage and the quality of healthcare services. Mobile health is the creative use of emerging mobile devices to deliver and improve healthcare practices, and also a smartphone application can support successful behavior changes for a long time, such as diets, such as education, improving education, ranging from, for example, a smoking cessation, weight loss, disease management, etc. Mobile health can improve health awareness and also has a benefit for the global health status. The categories of mobile health. For example, mobile health apps can be categorized into apps that support diagnostic and clinical decision making, support behavior changes, and digital therapeutics apps, and also apps designed primarily to deliver disease-related education. What is the importance of mobile health? mHealth is important because it makes healthcare practices accessible to the public through mobile communication technology in a variety of ways, such as providing healthcare information, collecting health data, analyzing data, observing patients, monitor, for example, symptoms, etc. The top two categories of mobile health are wellness management and also disease management. Other categories include self-diagnosis, medication reminder, and also electronic patient portal apps. All in all, mHealth describes the use of mobile and wireless communication technologies to improve healthcare delivery outcomes and also research. The goals of mobile health. Mobile health aims to improve care by making health information easily accessible for patients with long-term conditions such as chronic diseases or such diseases like diabetes or cancer, etc. The vast majority of which are designed for patients because, for example, patient-centered care nowadays also need to focus on because most of the patients with chronic disease need help in their life to improve healthcare, to improve the quality of life. Another goal of mHealth, for example, one of them is develop patient-centered healthcare delivery. As I told you, increase self-management of illness, reduce number of hospital beds occupied, remote monitoring, and also smart diagnosis. At the end, improve disease management. The success factors of mHealth are aim, user, location, regulation and content, platform, and idea. For example, when we want to develop an application, we should consider all of them together to, for example, follow our goal to be successful. The barriers and issues of mobile health are regulatory, privacy and security, integration, reliability, accessibility, acceptability, usability, confidentiality, integrity, knowledge sharing, system flexibility, lack of teamwork, poor security, high price, lack of clinician involvement, and poor attention to usability. The challenges of mHealth. So you can see, for example, the usability challenges in system integration, data security, and privacy. That is very important for patient network access for example, rural area, and also reliability. In this slide, you can see the article that I published with the title of the impact of mobile health and cancer screening. Hope it will be useful for you. And at the end, you can have the comparison of mobile health and health app. The health apps are for consumer only, but mobile health solution improve the collaboration between patient and healthcare professionals. And the summary of what I told you is, for example, overall digital technology has transformed healthcare, and also this transformation is expected to continue in the years to come. And also artificial intelligence, machine learning, deep learning, blockchain, healthcare mobile apps, wearable, and many others such advancements will change the future of healthcare as long as healthcare organizations and healthcare professionals keep their minds open and also create the required infrastructure and system. There is no saying how far digital technology can go in healthcare. These are my references. Thank you so much for your attention. If you have any question, you can contact me. Thank you.